Good morning. This is Surendran Subramanian, and this is my second case study seminar. It's on spinal cord injury. So, what is spinal cord? Spinal cord serves as a major conduit for motor, sensory, and autonomic neural transmissions between the brain and the body. So, it sends neural signals from the brain to the body, and from the body it receives from the body and it is sent to the brain. So it acts as a transfer medium between the body and the brain. So it has spinal cord is surrounded by so many vertebrae. We have around 33 vertebrae in the body. First part, there are 7 vertebrae of the cervical region and it is called cervical vertebra, and from C7 from there is 12 thoracic vertebrae and 5 lumbar vertebra and 5 sacrum and 5 coccyglia. So totally it makes 33 vertebrae. When it comes to an injury, we can classify into complete or incomplete. And anything, any injury, spinal cord injury, which affects the cervical area, that is above C4, that's going to result in tetraplegia. Tetraplegia is nothing but a complete or incomplete loss of motor or sensory function through the body, both the arms, both the legs, and the trunk. Whereas any injury which affects any part of thoracic, lumbar, and sacrum, that's going to be called as paraplegia, where motor and sensory functions are completely or incompletely affected, along with some portion of the trunk on lower and the lower legs. And the most common type of injury is motor vehicle collisions. If you see, men are more affected than women from the age of 60 to 30 years because of this motor vehicle accidents. That is the most important cause of spinal cord injuries. So let's discuss about a patient named Shalini in this presentation who has had an injury in spinal cord, and let's discuss. In this case study, we're going to see about a patient called Shalini. She's a 27-year-old female who used to be very athletic since childhood. She plays a lot of professional tennis games, but unfortunately, at the age of 21, during skiing, she injured herself. She had an accident during the game, and there was a complete spinal cord injury at the level of T10. According to the American Spinal Injury Association impairment scale, she was classified to type A. The right side, I've given you the Asia impairment scale. I will show you. Here's the classification of A. So, it's a complete injury with no sensory or motor function preserved. So, she is a paraplegic patient with a lot of loss of sensory and motor function on the lower leg. That is how the impairment scale prescribes it. But she is very courageous, and after the spinal cord injury, she still continued playing professional wheelchair tennis. Of course, with some kind of a modifications, especially to control her spasm, and she used to get recurrent urinary tract infections too. So she had antibiotics for that too. Now she has a dream that she wants to get into Olympics and compete in tennis in Paralympics. So she started rigorous training for that, but during the course of training, she felt pain on her right shoulder, and often she felt so tired and fatigued, which affected her performance. Now, Shalini is here to reduce her shoulder pain and to train properly and prepare herself for the Paralympics and to reach her dream. Let's go into subjective examinations. Her main complaint is again right shoulder pain with fatigue and fear of injury while practicing. Present history is she complains of pain in her dominant right side while she practices, which is always accompanied with fatigue and tiredness. And one major thing is she's affected while she serves while playing, because in tennis, service is the most important component of the game. Past medical history, she we discussed it earlier. She has a sports injury, had a complete spinal cord injury at T10, and it's classified as type B according to the Asia impairment scale. And medical diseases, she doesn't have any diabetes, TB, blood pressure, and asthma. Family history, her mother is diabetic and she has hypertension for past 5 years. And father, he died at the age of 45, but by heart failure. So this is one of the major risk factors which we need to consider, because her father died at the age of 45 is one of the major risk factors for the exercises. Smoker, she's a non-smoker. And physical activity, of course, she regularly exercises for her training, so that's not a big problem. Medications, she she's been prescribed baclofen and ibuprofen. Baclofen is mainly for her spasm, is an antispastic drug. Ibuprofen is to relieve pain, especially, and ciprofloxacin is for her recurrent UTIs. Her age is 27 years, so age is not a big risk factor too. Effects on ADL, she's highly independent in her ADL activities with her high skill level in wheelchair handling. So she can handle herself mostly in all aspects of ADL. Diagnostics, MRI, she has done MRI and X-ray too, but MRI will clearly show the impact of the complete injury on spinal cord. Let's discuss about the medications. She administers baclofen, ibuprofen, and ciprofloxacin. So the major effects, primary effects of these drugs, it reduces muscle spasm, reduces pain, cures and prevents recurrent UTIs. According to the drugs.com, I have taken the interaction which happens between the drugs between ciprofloxacin and ibuprofen. If you take ciprofloxacin alone, it has an effect on central nervous system which has side effects such as tremors, involuntary muscle movement, anxiety, confusion, depression, hallucination, and seizures. Combining it with again ibuprofen is going to increase the risk. So we need to discuss with the doctor and get the drugs effect a little more down on this aspect. Next on and this is a major thing, exercise effects on drugs. So she might feel dizziness, hypotension, drowsiness, hallucination, and seizure. This should be explained to her clearly. Okay, let's get into the objective examination. First, we'll see about the vitals. Her heart rate and BP is not in the normal range, it's dropped down, because in a spinal cord injury patient, autonomic system gets disturbed. When that system gets disrupted, automatically there will be a drop in heart rate and BP. That might be one of the reason. And one more reason would be she's having drugs. The effect of drugs will also have an effect on the BP and heart rate. Respiratory rate is good. SpO2 is in normal range, 95%. General appearance, you can see her height and body weight is in normal range. BMI also is in perfect range because it should be below 25. She's having 22.4. Nails clubbing. This main component is looked to check whether the patient is having any heart problem. It's say in spinal cord injury patient, the second most common death is due to heart problem. That's why I've checked nail clubbing also here. And blood tests, I've seen cholesterol, blood glucose, both are in normal range, because in spinal cord injury patients there will be always a rise in blood glucose level. So that's why I've checked it, but she has a good normal range blood glucose. And I've checked lipid profile and high sensitive C-reactive protein too. Pain scale, we see this is the normal pain assessment tool. Oh, she has level 8 pain here, that is very severe when she lifts any objects above her head, and during rest her pain is only 3. So it clearly shows only during the activity, especially while playing, and any objects lifted above our head, resulting in severe pain. So posture check, she automatically there will be some muscle wastings when a patient is in a wheelchair. But since she has been playing a lot of tennis, she's okay with it. But little bit muscle wasting is seen on the right side of deltoid pectoralis major, rhomboids minor, and anterior. So we might concentrate more on that. Now let's discuss about motor and sensory examination. Before getting into this, we need to know what are the signs and symptoms of spinal cord. The major signs and symptoms are sensory loss, motor paralysis, flaccidity, spasticity of the muscles, and neurogenic bowel and bladder disruption, and pulmonary dysfunction. These are the major reasons. These are the major signs and symptoms. Now let's go to neurological examinations. You see, according to the Asia Impairment Scale, she is classified into type A and T at the level of T10. And sensation is compared with the normal thing where it's also intact at the level of T10. Deep tendon reflexes is calculated according to the gradings. It's graded from 0, 1 plus, 2 plus, 3 plus, and 4 plus. Therefore, 0 is no response at all, where 4 plus has a very high brisk response and it's considered normal. This patient Shalini has 3 plus below T10 level, which is very brisk and considered normal or may not be normal. These deep tendon reflexes are checked using a knee hammer. Now let's move on to muscle strength. Muscle strength again, we'll be using grades to check the muscle strength on the right side. Always first check on the left side to see how the muscle power is in the body, but that is going to be considered the normal muscle power, and then compare it with the right side. Compare it with the right side and take the measurements. And you can see the shoulder abductors, internal, external rotators, and flexors of right side shoulder muscles have grade 4, but other shoulder muscles have grade 5 for Shalini. And the left side, all the muscles are normal within the normal limits. Next, let's go to range of motion. This is measured using goniometer. And right side, all the shoulder movements are terminally restricted in all planes due to the pain. Frontal, sagittal, all these three planes where the range of motion is restricted at the terminal range due to the pain on the shoulder mostly. And due to the pain, she might not completely lift it, complete range, she cannot get complete range of motion. And the tissues might have gone for a little bit of constrictions, tightness, so that might have been the reason for the terminal range of motion restriction on the right side. But left side, the range of motion is full. Size testing. Exercise testing are done mainly to reveal the patient's exercise tolerance and the source of limitation. There are two types of exercise testing available for the spinal cord injury patients. One is wheelchair ergometry and other one is the arm crack ergometry. Now, for Shalini, we have taken wheelchair ergometry and we have analyzed her respired gas. Let's go to the protocol. Before getting into the protocol, we should make sure the patient is properly placed and adjusted in the wheelchair ergometer to get the optimal efficiency of the patient and to avoid musculoskeletal injuries. They should be placed properly with the strap on the torso to prevent injuries. Protocol, the wheel arm speed is set to 3 kilometers per hour. Initially, let's start with 5 watts, and then with that we can increase to 10 watts every 5 minutes. And the test duration was only 8 minutes because because it stopped because Shalini was not able to maintain a speed of 3 kilometer per hour at 15 watts. So that was the main reason for the termination. And the clinical measures which we need to see while the exercise testing is the heart rate, BP, rate of perceived extension, symptoms, monitor. And also, it is better to monitor throughout 5 to 10 minutes recovery after the exercise. The test analysis report states that she has a peak heart rate of 160 beats per minute, and her BP, you can see it's 190 by 75. You can see the systolic is not so high still, and a rate of perceived exertion is 18 out of 20, and VO2 peak is 19.7 ml, which is way low because the normal range should be more than 30.0 ml according to the research, but she's way much lower her oxygen capacity, so it shows clearly she has a reduced aerobic capacity and endurance. I've done some special assessments because she has shoulder pain and to check a bone density and wheelchair mobility. First, let's see about the near test. Near test shows positive. The patient is asked to sit on high sitting chair and her scapula is stabilized from the back by the therapist, and she is asked to internally rotate her shoulder and flex it to 180 degree. If the patient feels pain in 90 degrees, it's because both the spaces gets reduced and there's a impingement between bones of supraspinous tendon and subscapular bursa. So that shows that she has supraspinous tendinitis or subscapular bursitis. And next is the dual energy X-ray absorptiometry, which is mainly done by a clinician to find the bone density of the patient. When it comes to spinal cord injury, at least in first 4 months, 67% of patients will have mineral loss. That is proven in the research. So I want to know what's her bone density. So I've taken that test into my consideration and seen the results to check whether the patient has a lot of mineral loss. If she has a lot of mineral loss and the bone density is less, I can't make her lift heavy weights because that will cause fracture too. The next is uh, we have done a mobility assessment on wheelchair. That's based on wheelchair and ambulatory sports USA. The clinical exercise physiologist determines the degree of impairment as it relates to exercise with this assessment. According to it, she is classified into T54 with T10 neurological level. That means she has abdominal, back extensor, and both upper and lower extensors prominent. She can utilize it for the training. I've done some mobility and ADL evaluation too for Shalini, and I've calculated it using functional ability by level of spinal cord injury in the book of Clinical Exercise Physiology, third edition. According to it, she is independent with bed mobility and she can transfer to all surfaces, including wheelchair to floor, and she can do a pressure relief on her own, and she can take care of her bowel and bladder by her own. She can do the dressings by her own. Only problem is like she needs little bit help in driving as well as ambulation. Apart from that, she's highly independent and she has high level of wheelchair skills too. Risk stratifications. For the family, you can see her mother is diabetic and she is hypertensive. For the last 5 years, she's on medications too. Father died at the age of 45 due to heart failure. This is the major point to be taken in consideration because this is a high risk factor. And as already I've discussed, the spinal cord injury patient, the second most major cause of death is heart failure or heart problem. So this has to be the one of the major risk factor for her. And spinal cord injury is also one of the major risk factor. But if she has a medical clearance from the doctor, she can participate in the vigorous exercise program, which she has already got from a physician to come here. And age and physical activity and BMI all are in normal. Age is just 27, and that is not going to be a big affecting factor for her. And she exercises regularly, more than 300 minutes per week. So she is physically active, and her BMI is in normal range. As it is in cholesterol and blood glucose, both are in normal range. But in spinal cord injury patient, there will be always a rise in lipid profile and even in the glucose level. So, but she has maintained it properly. So, with this, Chalni has only one risk factor, so she is to be considered as a low risk patient. She can participate in the vigorous intensity program and prepare for the Paralympics. So let's discuss about Caronin formula. It is nothing but a mathematical formula which is used to determine the target heart rate. Initially, this target heart rate is used for the training purpose where the patient is maintained that zone to be inside that zone like 50 to 80% to achieve the desired target goal. And not only that, if sometimes if they exceed the target heart rate, there might be a provoke of signs and symptoms, so which will really create a problem. So we should always maintain the training between this heart zone to get the results. And to achieve target heart reserve heart rate, we first need to find the maximum heart rate in which the maximum heart rate is 220 minus the age. So she's 27 and the heart rate is maximum heart rate is 193. So to find the targeted heart rate, so we have a formula. You can see maximum heart rate minus resting heart rate multiplied by the percentage of intensity which they are going to be trained plus the resting heart rate. So now it's 193 minus 66. It's a 66 a resting heart rate multiplied by 50% to 80% is going to be our targeted heart zone and plus the resting heart rate which is 66. So we can see the results for 50% she has a 130 beats per minute, for 80% is 168 is the heart rate. So we should train her between 130 to 168 from the moderate to vigorous intensity. If it's going to be vigorous intensity, it's going to be from 60% to 80%. So we have done with the assessment and we have found that she had right shoulder impingement syndrome, which is leading to the pain, and her cardiovascular efficiency is reduced, which is like aerobic endurance is reduced, and her muscle strength is slightly reduced on the right shoulder for some certain muscles, which we have already discussed, and then and there is a terminal restriction in their range of motions. So with that, we're gonna plan the treatment for her program. First, we need to find what are Shalini's goal. But the main goal for Shalini is to get into Paralympics and compete in the tennis games. So for that, we need to improve her cardiovascular fitness first and increase upper extremity muscle strength and endurance and reduce shoulder pain and fatigue while training and improve flexibility and right shoulder range of motion, which is already restriction. So these are the main goals which needs to be treated. So this is the continuation of plan. Shoulder pain is one of the major concern for Shalini, and she is having a fear of getting pain while training and which would even stop her training. So initially I wanted her to do an ultrasound therapy, which is very efficient for the bursitis and tendonitis. It's usually done by a physiotherapist for a week, and depending upon her pain, the frequency and intensity will be calculated by the physical therapist. So it is better to have an ultrasound therapy for a week and get the pain subsided. So once the pain is subsided, and it will be easy for us to get on going with the resistance exercises. Otherwise, if the pain is more than 50%, it's going to give more damage to her tissues if she's going to continue in vigorous exercise pattern. So it's better for her to go for a week with the physiotherapist, get it sorted out, and then we can start. So I have divided the components which needs to be concentrated. First is the cardiovascular, in which we have to concentrate more on increasing our VO2 peak, which is only 19, should be more than 30 ml for oxygen according to our age. And this has been proved in the clinical exercise physiology, third edition, and to improve aerobic capacity and endurance, and also to increase exercise tolerance, which is more important, and to increase cardiac output and stroke volume, which is always less with the spinal cord injury patients. And next component is the muscle strength and endurance. Mainly, we should focus on increasing strength and fatigue resistance in deltoid, internal and external rotator, and rotator cuff muscles on the right side of the shoulder, which is of grade 4. And then to increase the strength in serratus anterior, trapezius, and levator scapula on the right side, because that is mostly useful for the patient to clear her seat to lift her up to clear pressure shows. And then wheelchair propulsion muscles are very, very important because in wheelchair tennis, she needs to use her muscles to move around in and out to go and hit the ball. So like triceps, biceps, and latissimus dorsi, flexor, and extensor carpi should be trained on both sides. But it is always good to strengthen both arms. So she's a tennis player. And then next component is the flexibility. It is mainly to increase the range of motion, which is lost. Let us say it's when it comes to terminal range, it will be like 160 degrees to 180 degree, maybe 20-degree loss of range of motion in the shoulder, where we can assist her to increase the range of motion by doing some stretchings. Assisted stretchings as well will help to increase the range of motion, and that is mainly because of the pain and the tissues which is restricted due to the pain tightness on the tissue. And second thing is to reduce the effect of spasticity in the upper body and also to relax the muscles after exercises. So Shalini's exercise program will be designed using this table as a reference with slight modification as she is wheelchair bound. This table is from basic. It's a basic CDD4 recommendation from ACSM guideline books. This is recommended for Shalini with slight modification because she's in wheelchair. We're going to slightly modify that and then work around. Before getting into the exercise program, we should pre-prepare ourselves. Um, Here you can see Shalini, she should exercise in a climate controlled area to avoid the risk of hypo or hypothermia because spinal cord injury patients will have a thermoregulation impairment. So that's more important to work out in a climate controlled area. And the therapist, we should know about the contraindications which from which they should not exercise, such as high autonomic dysreflexia, orthostatic hypotension, recent pulmonary embolism, or deep vein thrombosis, pressure ulcers, active tendinitis, and spasticity. And patients should be well educated about the symptoms that might occur, which is due to the medications which they are taking, like dizziness, tremors, seizures, hallucination, and dry mouth. If they have any kind of symptoms regarding this, they should immediately stop and inform us. And use of upper armbands or Coban tape is mainly to prevent the abrasion on the medial upper arm on the wheelchair because that is more important. And we can use abdominal blinders and leg wraps mainly to facilitate improved pulmonary dynamics and greater venous return. And she would be told to expect delayed onset of muscle soreness as happens in a normal individual. Since she's going to compete in Paralympics, would advise her to train with a personal trainer for 6 months to avoid injury and train with a proper form of exercises. And for shoulder pain, it's an overuse impingement syndrome. So she should use hot packs before exercising and cold pack after exercise. Hot packs before exercise is to get ready the muscles so that she can start exercising. Cold packs is mainly to reduce the inflammation which has happened due to the exercise and relax the muscles. So using the FIT principle, I'm going to design an 8 weeks program for Shalini, which will be including cardiovascular exercise training, resistance training, and flexibility training. So now let's see the aerobic exercises. The overall training induced increases VO2 peak and may not be caused by only the central cardiovascular limitation, but it increased active muscle and the venous return of the blood and peripheral oxygen extraction in the trained muscles. The reference is given, so we can check on the last page of the presentation. In 2006, SCI, that is spinal cord injury rehabilitation evidence, evaluated using voluntary upper body exercises performed at a moderate to vigorous intensity for 20 to 30 minutes for 3 days per week, and it was done for 8 weeks at least. And we have seen a positive effect on the risk factor related to cardiovascular diseases because spinal cord injury patients are more prone to cardiovascular diseases. And it improved exercise tolerance, VO2 peak, and power output. When it comes to frequency, she has to work 4 to 5 days per week and two supervised sessions. And intensity, rate of pursuit exertion should be 11 to 13 on a 20 dyspnea scale. The heart rate ratio should be 30% to 80%. We can use even talk test to check her intensity. Doctors should be like, they should speak properly without any error. So the type of exercises, arm crank ergometry can be used, and wheelchair propulsion exercises can be used, and rope training can be used. Time initially we can start with 15 to 20 minutes with rest stops in between if they want, and then increase 5 minutes every week and end up to 40 minutes per session. If strength training is included, we can stop for 30 minutes per session and we can do 10 minutes per session along with it, 10 to 20 minutes of strength training along with it. So special considerations we can say: avoid external hypotension, avoid thermal stress, and include warm up and cool down. Okay, let's speak about the resistant exercise. Planned and structured scapular stabilization, rotator cuff resistant exercise, and pectoral muscles is likely to increase the strength and reduce the risk of overuse injury, which is a major concern for traveling. So I've given the reference of it on the latest stage. Initially, it is always good to start with the isometric contraction and then progress to dynamic exercises. We can use elastic bands initially and then progress again to free weights. Uh, when the person is using free weights or isokinetic or isotonic machines, it is better to put wheelchair brakes before they start lifting to avoid musculoskeletal injuries. And according to Jacobs, resistance circuits training will be the best choice because he has done a research on which he has done resistance circuit training with an intensity of 60 to 70% of 1 RM that have increased the muscle strength up to 50% than with the group which has trained with only using arm ergometry. Frequency, initially we can start with one set uh, for 2 days per week. The training can be done for 2 days per week. We'll start with one set initially and then progress to two sets in the following 8 weeks. Intensity, let's start with 50 to 70% of 1 RM, and then the repetition can be from 8 to 12, and we can increase the resistance when they have already repetitions when they've reached 12 repetitions. And type, we can use elastic band to strengthen, and free weights like dumbbells and wheelchair accessible machines and should be there, and isometrics with the use of therapist. Initially, time initially start with 30 minutes and slowly progress to 60 minutes at the end of the training. Special consideration: avoid Valsalva maneuver. Try to use seat belts and chest straps to increase the balance, and use adaptive grips and mitts because gripping will be a major problem with the spinal cord injury patients. And do not exceed stress limit of wheelchair. A wheelchair has a stress limit. Every wheelchair. So we should know the stress limit of a wheelchair, and we should never exceed or put more stress on the wheelchair. Otherwise, it will cause some breakage problems. Let's start with shoulder and scapular stability exercises. These exercises can be performed every day. Initially, we can start with 20 repetition and progress to 50 repetition as tolerated by discomfort and fatigue. We can increase it to two sets as tolerated. And this is the most important primary muscles which is used while playing tennis and handling wheelchair. So I'll show you the exercises quickly. Consider this as a wheelchair. Connect the elastic band to the wheelchair. Yeah. So consider this the wheelchair, and then it is this is shoulder abduction. Bring it up to 90 degree and get it down. We can go to 180 degree and shoulder flexion straight up to 180 degree and get it down. And then shoulder extension. Try to pull it back and get it back. Okay. Flat pull down. Try to connect it with some other external surface here. I'm using my window here. Sit down. Keep your back straight. Pull it back. Pull the arms back near chest and get it back for that one. And for reverse plank, you can ask it to keep straight and then pull it back. This works your retractors of the scapula. And for shoulder internal and external rotators, we can connect it with any other surfaces side, and then we can do internal and external rotation, and then we can do. Let's discuss about aerobic exercises. Always start with a warm up. Warm up is good to reduce injuries and to avoid exacerbation of signs and symptoms. Start with 10 minutes of arm ergometry with RPE less than 11 out of 20. Try to apply hot packs over the shoulder so that the gets the complete circulation increase. The muscle is increased with the circulation, and then the muscle is heated up and prepared for the activity. At the same time, it also reduces some of the shoulder impingement pain. Exercises I have given a two exercise arm crank ergometry and wheelchair ergometry. Both increases the aerobic endurance as well as wheelchair ergometry increases the propulsion of the wheelchair, which is most important for our tennis activity. Intensity, both we can start with 30 to 60% of heart rate reserve and then progress to say 80%. Duration, we can start with 10 minutes for the first 2 weeks and 15 minutes for the next 2 weeks. So totally in this 4 weeks, they will attain 30 minutes of aerobic activity. Try to perform 4 to 5 days a week. 2 days will be under my supervision. Okay, let's see about the resistance exercise for the first 4 weeks. Again, start with a warm up, 5 minutes of arm ergometry with RP less than 11 of the 20. And try to do dumbbell chest press for 10 repetitions and shoulder flies for 10 repetitions. And try to apply hot packs over shoulder. And let's see the exercises. Let's start with isometrics. Shoulder abduction, flexion, and extension isometrics. Try to apply pressure by your own or try to use the get the help from the CEP. You can hold for the abduction. Try to hold on the lateral side of the shoulder, lateral side of the forearm, and try to push the joint outside. Push the arm outside, but try to push, but make sure that you don't move. Try to give more stress and hold it for 20 seconds and relax. Try to give 30-second rest and do the next one. For flexion, hold, place the arm over the anterior forearm and try to push forward and not move, don't move the joint. Try to push and give stress. Hold for 20 seconds. The same, try to place your arm in the back and try to move your arm back for the shoulder extension. For the chest fly, consider this as a dumbbell. Try to bring it out, keep your back straight, and get it in and out. Try to breathe out and breathe in. That is more important. Breathing pattern should be followed. 8 to 12 repetitions. And for biceps curl, try to bend and stretch out. Then bend your elbows forward, keep your back straight, tuck your tummy in, and then pull up and down slowly. For forearm supination, keep your arms towards the body, hold it tightly, and try to move in and out. Inward, try to rotate in and out. Only the forearm should be rotated. For the triceps press, we can use the dumbbells or machine. For dumbbells, try to keep it and then pull it up and down. So that works your triceps muscles on it. So let's see abs twist with arm paste. Consider this as a medicine ball. Keep it 90-degree up, raised, and then try to twist your body. Twist it. So this works the abs muscle and the internal and external oblique along with the abdominals. This pushing is nothing but sitting in a wheelchair and placing on the wheelchair ergometer and asking to propel forward this pushing. So this improves the anterior and posterior deltoid along with the muscles chest, which is responsible for propulsion, which is more important in the game. And horizontal back, pull back, keep your back straight, and then pull it back horizontally. Okay, this is horizontal pullback. It works the latissimus dorsi muscle, which is more important. And working out all these exercises will improve the strength and endurance of the muscle. Again, 8 to 12 repetition is done, and one set is done for the initial stage. So let's go with the fifth to eighth week of aerobic exercises. Warm up is same, continue the same warm up, and cool down is also same. But I've not discussed much of the cool down, but it should be done 5 minutes of arm ergometry with RP less than 7 out of 20. Try to stretch all the major joints actively, and also you can use Tai Chi to induce relaxation to the muscles. It's a very slow movement, it will induce relaxation. And try to apply cold packs on the shoulders so the muscle, the tissues which is inflamed due to the activity will reduce, and then the pain will subside along with it. And let's discuss about the exercises. On the last 4 weeks, we have used the same arm crank ergometry and the wheelchair ergometry. See the intensity now I've raised it. Last time we have used only 40 to 30 to 60%, but 50 but here you have seen I've increased 50 to 80%. So I've increased the intensity, and the duration is also 20 minutes each. So at the end of 8 weeks, they'll be doing 40 minutes of cardiovascular activity, which is more important. And again, this can be done 4 to 5 days a week and 2 days under my supervision. So now let's discuss about the resistance exercise for the fifth to the eighth week. Same warm up and cool down should be followed. And about the exercise, we'll see about the exercise now. Initially, we started with isometrics and some of the elastic band training with some dumbbell exercises. Now it is with isometrics done. Let's start doing shoulder flexion, extension, and abduction exercise with the dumbbells. With the shoulder flexion, bring it up to 180 degree and slowly down. Try to do it at a slow pace. And abduction, bring it up to 180 degree and slowly bring it down. And for extension, keep it straight and then bring it back slowly and down. So this is for the thing. For chest press, again, we can use a machine. Try position her in the machine and try to push it straight and bring it back. Elbow should be placed 90 degrees in straight line and then push and bring it back. This works both chest and the upper scapular muscles. Triceps and TRX biceps curl. I cannot show you how it's done, but consider this as a TRX. It will be placed up and then you can just bend and then stretch it out. I have a TRX here. So you can see, but this has to be extended, stretch and bring it out, stretch and bring it out. And then circumduction exercise at full range to rotate it with the dumbbells. Use the dumbbells, slow and steady, slow and steady. And for the wheelchair tricep push, try to make her sit on the wheelchair and then with the help of her arms, try to push her up and down, push her up and down, push her up and down. Use the wheelchair to increase the tricep strength. So all these exercises can be done from 12 to 15 repetition because last time she has done from 8 to 12. I've increased the sets to 2 sets. We can have 30-second rest in between the exercises. Okay, let's concentrate on core again now. For abs twist, bring it out and in. Bring it out and in. Bring it out and in. Okay, for figure of 8, this works more for the core as well as try to use the medicine ball and try to bring it out and down and put a figure of 8. Draw 8 in the air with the medicine ball. So this works exactly your abdominals, external and internal obliques along with it. So TRX lat pull down, okay, bring it out, and pull, bring it in and out, bring it in and out, bring it in and out. That's a lat pull down exercise. I'm not showing it because I cannot use TRX clearly, but that is how it has to be worked out. So we have come for the stretching exercises. Stretching exercise mainly done to improve the flexibility on the joints. As we know, she has already got some terminal range of restriction on the right shoulder due to the shoulder pain and some constriction and tightness in the tissues. So we can use, the therapist can do some assisted active stretchings to increase that range of motion. Apart from that, we can start with the warm up for 10 minutes again with arm ergometry and then apply some hot packs on shoulders and then cool down will be the same. So let's start with the shoulder adduction. Keep your arm straight, hold it towards your chest, push it towards your chest with the other arm for 90 degrees and do it on the both sides. Try to give 30-second rest in between. Try to do 2 sets for all the stretches. Chest, sit, and reach on both the sides. I'll show you the last. Back stretch on both sides. Try to keep your back straight, and then try to bring one arm from up, one other arm from down, and try to catch the hands. Do it on the both the sides. And side stretch. Keep the back straight and slightly lean towards the other side, and feel the stretch on the lateral part. Cow pose is mainly done to have stretches on the anterior part of the body. You see, like a cow. Pose it like a cow. You can see the stretches will be more on the anterior, abdominal, and chest. Overhead reach. Keep your arms up straight and try to reach up. You can feel stretches on the arm side of the arm. So abs twist stretch. Again, hold it straight and try to twist and hold it for 30 seconds and hold it for 30 seconds on the other side. Let's see the chest sit and reach. Sit down. One leg bent and other leg stretched out. Try to reach forward and touch the toes and hold it for 30 seconds. Do it on both sides. And alternative leg touches. You can spread the legs and try to reach with your right arm onto your left leg toes. Hold it for 30 seconds and come. You can feel the stretch of the back. So I even given some specialized exercises for her. Since she's a very young lady, it will be always boring for her to do the same exercises. So I've asked her to do at least once a week in home these exercises. And sometimes when you train with a constant speed and intensity, you will reach a plateau. So to break down those plateaus, these exercises can be an alternative for them. For example, rope training, it improves the rotator cuff and scapular stabilizers, muscle strength and endurance of it. And aerobic capacity can also be improved, and especially it builds the core muscles. That is more important. It is a very new format of exercises which has been used in a lot of hospitals now to train these people and athletes. Then next aqua rehab with waterproof chairs. We can utilize them. We can ask them. We can pull them into the pool. That improves muscle strength, flexibility, and mobility without with less strains on joint. Because in water there won't be much resistance. With the help of buoyancy effect, we are going to strain and strengthen their muscles. So there will be no lot of stress in the muscles and musculoskeletal areas, joints. So that is the best format for her if she feels more pain on the shoulder. Adaptive Zumba. That is one more very famous exercise which was introduced in 2017 for all wheelchair patients, and that works out very well to improve cardiovascular endurance. Zumba is nothing but a dance format of exercise where wheelchair people they've designed an adaptive format for the wheelchair people which improves lung function and also aerobic capacity. So we can utilize all these specialized exercises and she can train accordingly whichever she is more interested in. To summarize, Shalini is a 27-year tennis player with a spinal cord injury. She wants to prepare and compete in Paralympics competition and find it's difficult for her because of the pain and fatigue which appeared during her training. Her training was completely interrupted. Pattern was interrupted due to the pain and the fear of injury. She came to the clinic to reduce the pain and improve her training capacity so that she can compete in the Paralympics tennis without any fatigue during the game. A complete subjective and objective assessment was done for her. Wheelchair ergometry test was done to find her aerobic capacity, which was very low compared to her age pattern. Special tests were done and found that her right shoulder had impingement syndrome and her strength was less in right arm compared to the left, and the terminal range of motion was restricted due to the tightness of the tissues. So, patient education regarding a symptom, drug effects, and the importance of continuing the program was completely done. She was educated well, and she was advised to even see a physiotherapist for ultrasound and for ultrasound to treat her shoulder impingement pain and for some advanced exercises which can be useful on the later for her tennis game. Keeping all absolute and relative contraindications in mind, complete treatment plan was designed using the FIT principle for her for 8 weeks, which included aerobic exercise, resistant exercise, stretching exercises, along with some specialized training, which was designed to meet her goal. Before starting the training, all precautionary measures were completely discussed and executed prior to the training so that she doesn't get any hypothermia or hypothermia attacks. And other precautionaries like contraindication, everything was seen to prevent exacerbation of her symptoms. Again, at the final, all the trainings and personal trainer. I've even advised her to take a personal trainer to train her for 6 months prior to competition so that she can train in a proper exercise format and to avoid stress injuries due to the pain. With all these things, we are sure that we can increase her aerobic capacity, resistant exercise, with resistant exercise, we can increase her strength and endurance, and with stretching, we can improve our flexibility as well. So this exercise program will be more than enough for her to be well prepared before getting into the before getting into the training on vigorously to the tennis competition for the Paralympics. So this is about the presentation. Thank you. So these are the references which I have used while preparing my presentation. I've taken all these references and this is proved. So whatever I have given in my presentation, we can refer to this reference. So we have come to the final stage. Thank you for viewing my presentation. I hope that would have been more informative. And thanks once again for seeing my presentation. Thank you.